The outbreak of Lassa fever in Nigeria has once again exposed the danger inherent in unhygienic environment, which leads to the spread of diseases. Just like Ebola, the fear of Lassa fever is the beginning of wisdom. Nice to have you back on your health program showing on the Unity Station, NTA Abuja Channel 5. My name is Deborah Nemi Usman. We are sure to bring you insightful discussion and analysis on health matters. Today, we will be discussing the effect of our environment in the spread of disease and tips on how to keep our environment clean. Consequence on the death of some Nigerians from Lassa fever. It has been acknowledged that the disease is spread by rats and rodents in our environment. But how clean is our environment? Let's take this picture.
After the Federal Capital Territory recorded its first casualty in Lassa fever, various organizations swung into action to combat the spread of the disease, from creating awareness to setting up of isolation centers for the treatment of the affected victims. Our environment plays more host to agents that spread Lassa fever and other vector-borne diseases. In 2004, the Satellite Town Development Authority (STDA) was established to fast-track development in the satellite areas such as Kubwa, Karmu, Lugbe, and others. While the city centers look tidy, the satellite towns provide a breeding ground for rats and rodents because of the untidy nature, human population, and size.
The reason why the agency was department to establish, like I said, is to provide infrastructural facilities and services that will make life livable in the satellite towns, make life livable so that people at par, almost at par with the city. What I mean is providing road network, providing electricity, providing water, provide environmental services, such things that is required of the city, that is done in the city at a standard, at a reasonable standard, so that people, rather than traveling to the city to live in the city, will want to live in satellite towns, and such as that's how it is all over the world. People like to live in the suburb. If you have all the facility that is in the city, you enjoy the same facilities in Karishi, Kubwa, Wagwalada. What is the point of coming to live in the city?
Indiscriminate dumping of waste is a common feature in satellite towns, from lack of waste disposal to non-evacuation and improper management of septic tanks.
Not that they don't know that it's not wrong, because they feel everybody is there to arrest them. The consciousness is not there for them to say, this is what I'm doing is not right. Rather than doing that, why not whatever you have generated in your vehicle, drop it within your vehicle. When you get to the next point of where you stop, you pack all those things and put it in the proper that's provided. It's not done anywhere. In the villages where we all come from, we don't keep garbage in front of our houses. We put it, find somewhere at the back of the houses where garbage is being kept. So that is what is happening. And as much as possible, that's why we are trying to generate this awareness. Not that we don't have collection points in these areas. We have collection points. If you take it to a collection point, it will be easier for us to evacuate, and the city will be cleaner.
Residents are of the opinion that those concerned need to do more on waste management.
At the back of a bag, I get the dustbin from my house. If you pack away dirty, I carry inside bush.
This place, you know, is not an established place. So government has no concern here, as you can see. There's no light here. They're not even talking about it, not even water. They're talking about coming to talk about waste. Most of the people are not even they are defecating in the bush. I will hardly see a house here that has a waste disposal house. It's their work to provide waste bins for us. Then we can do our part. If we fail to make use of them, they can take their actions.
They normally bring nylon for us, those big nylon. You know, we pack them, and after we pack them, we'll dump them in that side. They'll come and pack it. They normally come to pack it. We need them to be assisting us, just like what they normally do sometimes. You know, bringing those people that they employ. You know, to be happy, because we normally pack it sometimes. Sometimes they won't come for very long time.
I want government to to send those people that used to pack dustbin to help us to be packing all these gutter and the waste bin that we used to pack and keep on the road. We used to pack them. We used to pack them at times, but nowhere to throw it, because where to throw it is very far from us. But when they come, they will help us. When we pack it and keep it on the road, they will help us and pack it and throw it far away from us.
Despite the fact that waste is a natural product of human existence, invariably, it can destroy lives if proper management is not put in place. However, what are the measures put in place to manage waste in satellite towns to forestall the spread of communicable diseases?
What we are doing essentially is to collaborate with the area council authorities in all the 6 area councils, so that we now join hands together to clean the satellite towns and the villages. What we are doing right now is to speak to people from the community base. Speak to people in the community that the environment, the issue of environment, the issue of sanitation is all inclusive. It has to start from the home, and basically everybody must participate in it. Everybody must be passionate about the environment, where you live, what happens in the environment. And so if you don't care about environment, if there's any problem, you are going to be the first person that will face the negative impact of whatever comes out of it. In the last 1 month, apart from our previous video programs, television program, we've been visiting the community leaders. We had a sensitization program with the chief of Karo. We had one with Karo. We had it in his palace. The market women were there. The residents association were there. So many other people that live around the Karo community were there. We tried to sensitize them, to let them know that the idea of not only Karo, when we did Karo, we did the same thing in Peggy, we did in Kudu, we did in Orozo. As much as possible, that's why we are trying to generate this awareness. Like, for instance, we had to go to Kurudu. This thing is very much pronounced on Kurudu. We went to Kurudu, those people that mark along those people that trade on the roadside. We hold a sensitization meeting with them. We discussed with them, we told them that this is not right. We have a collection point that's not far from you. Why not take your waste to that collection point for government to come and pick it up? And we are looking at some of the things we want to do. We want to distribute our Roro bins. The Roro bins are 2 12-meter cube bins. They are very light bins that will be evacuated. It will serve in all these areas where people cannot access collection point. It will not be too far from there. They can take their waste there. Then our trucks will come and evacuate them. We're looking at starting from this area that is more that is prone to this kind of illegal indiscriminate dumping along Kareshi Road. We'll place them at strategic positions along the Kareshi Road, so that way people can make use of them and at the same time use the collection point.
Although waste management and disposal are not institutional responsibilities alone, but collective efforts that affect every Nigerian.
Waste can destroy lives if proper management is not put in place. However, we are glad that the relevant agencies have come up with guidelines for waste management. Still on the danger of unhygienic environment, Dr. Lanre, a public health expert, speaks to us on waste management and its implications.
Why is waste management a challenge in our society?
The first thing we fail to acknowledge is that refuse generation itself is a natural product of human existence. Just like everything, you find out that as long as human beings exist, refuse will have to be generated. And it's refuse, or what we can call waste management, because talking about waste really, we talk more about both refuse and sewage. And when you talk about waste management generally, it's an institutional thing. It's not something you leave in the hands of individuals or the whims and caprices of society. It's something that has to be an established system to manage those waste. And the reason is not far-fetched. If waste is not properly managed, it has a lot of impact on the health of the community. So we need to acknowledge the fact that waste disposal or refuse generation rather is actually a natural product of human existence, and it is acknowledging that we ensure that proper systems are put in place to manage those waste. The interesting thing is that everybody likes clean, neat city, and these refuse and waste are completely unsightly and nobody likes to see them. But the problem is that more often than not, we fail to put in place sufficient system in order to ensure that these wastes are properly disposed of. Like I was saying earlier, we find out that the way not improper management of waste impacts on the community, on the society, and largely on the health of individuals and community as a whole is quite huge. And it is when we understand that we'll be able to know that whatever cost or whatever it will take us to make sure that waste are properly managed cannot be compared to the price we have to pay when they are not properly managed.
Is it possible for someone to reduce the waste he or she generates?
But the waste, the amount of waste that an individual, a family can generate is very difficult to quantify. And then rather than being fixated on trying to help or make sure people reduce their waste generation, what is actually actionable or doable is to ensure that proper disposal of those wastes are put in place. You see, one thing we need to appreciate is that people don't do what you expect, they only do what you inspect. And so as long as these things are not being checked, it is very natural that people will not do the right thing. So waste generation is, as earlier said, a natural product of existence. And so it is going to be very difficult to actually say, okay, let's work towards ensuring that people reduce the waste they are generating. It will only be proper for us to ensure that when people generate this waste, these wastes are properly disposed of. That is what is achievable.
How should waste be managed?
Waste generally could be sewage or refuse. When we talk about sewage, we talk about the human excretors and all of that. And then we talk about refuse, we're talking about the solid waste system. Now, in talking about waste management, you have to clear, a lot of people don't even know. You find houses, especially in the suburbs and in the slums, that they even build houses without putting a toilet. You want to ask whether they actually assume that people who live in those houses will not have to, defecate at one point or the other. But, so what to start with, we need to let it be in the consciousness of people that as they build houses, as they plan where they live, they have to put in place proper channels to manage the waste they will generate. And that includes ensuring that, toilet facilities are put in those places. And that also includes that arrangements are made for all those, soakaways and toilet, facilities are evacuated when they are filled. Then second to that, next to that rather, is the refuse. Refuse is more of a problem even to our society. The unfortunate thing is this: if you are my neighbor and I properly manage my refuse and you don't, then whatever side problem that will cause will not only affect you but will also affect me. So you see, it's a communal responsibility. So what is important is that when individuals are encouraged to ensure that their wastes are gathered, the government too should ensure that these wastes are evacuated and properly disposed when they ought to. So what it means is that there should be a rule or a guide in place that is brought to the consciousness of people how their wastes are meant to be, evacuated at regular interval. That way, we'll be able to manage those wastes properly.
What should be the role of government in waste management?
You see, the issue is this, like recently, not too long ago, there was an outbreak of Ebola viral disease, and what do you see? You see a high consciousness towards, hand washings and cleanliness and all of that. And then not long, just around now, we've been hearing about Lassa fever outbreak everywhere, and people are becoming a lot more conscious about how their waste are managed and disposed of. Now, for government to wait until there is an episodic epidemic that comes up, and then that's when we begin to hammer it on people, it's not going to help us. What we rather should do is because waste, sanitary actions, waste management, or what we can even call personal or environmental hygiene, they are actually habits that people should imbibe. and it should be part of them. So rather than wait until situations arises that now make people to begin to take action. And you see, immediately the Ebola episode, was over, people just went back to who they used to be. So the idea, in those days, during the Ebola, episode, you find out that when you even go to bank, you see, hand sanitizer, you see, hand washing machines and all of those things. But if you go to those places now, all of those things are no longer functional. So we shouldn't think that it is only when there are epidemics or, problems that we should become conscious of how we take care of ourselves, our waste, or even our personal environmental hygiene. We should rather ensure that these things are part of us, an habitual, it should be an habit, something we do all of the time. It is in so doing that we'll be able to prevent all of these, epidemics that take advantage of our unsightly environment to spread.
What are the implications of non-evacuation of waste?
The health implication of, improper disposal of waste is enormous, and then we need to appreciate and understand it from the fundamentals, because like it is always said in public health dictum, prevention is always better than cure, and it's also always cheaper than cure. So when we properly manage our waste, we're actually preventing a lot of things. Unfortunately for us in this part of the world, we still struggle a lot with with a lot of communicable diseases, or what we call infectious diseases. Now, these infectious diseases are actually, some of them are actually vector-borne. Now, vectors that propagate or spread these diseases are things that proliferate more, or they breed in an environment that is unhygienic and that is not clean. Take for example, the common thing we know is mosquito. Mosquito is the vector that bears Plasmodium parasite, which is a causative organism for malaria. And you agree with me that during rainy season there is always an increase in the incidence of malaria. The reason is not far-fetched. It's because mosquito breeds in stagnant waters and bushes and places that are dark and unsightly. And therefore, when you go to environments where these things are, it's easy for mosquito to breed, and the consequence is that mosquitoes, malaria incidence will increase at such time. Beyond that, you also know that we have had incidences or cases of gastroenteritis, which is more always caused by organisms like Shigella. You have organisms like cholera, and these are very highly communicable diseases. And you also want to agree with me now that we have a lot of people who are moving around because of insurgency here and there. You have congregate settings all over the place, even in Abuja as a city, and all of these things further aggravate the already bad waste generating mechanism that is in place. So if we don't take preventive measure, what will happen is that this vector breeds, and the breeding of this vector increases incidence of communicable diseases. Now everybody is talking about Lassa fever, and we know that Lassa fever is bound by rats, multi-mammate rat that everybody has been told of, and everybody is aware of those things. Now the problem is that what attracts rats home to the homes of people? It is waste. So if you have heaps of waste around and in your houses, tendency are that rats will get into your house, and the risk of you getting some of these infections that is very lethal and serious, and you know what has happened to people who have been infected at different places, is very high. And you also want to see it from economic perspective, because our health system is already burdened with a lot of preventable conditions. And if we allow, improper management of waste to further aggravate that, that means we are going to have a condition in our hands where many more people will be losing man-hour, to hospital attendance, and resources that should be channeled towards managing situations that, require, more attention will now be diverted to manage some of these conditions that could have been prevented if proper things had been done. And one of the things they are doing to make sure that we no longer get into that kind of situation is to increase the diagnostic capabilities of healthcare workers so that they can identify these conditions and report appropriately. So it's to increase our surveillance system. If our surveillance system is working, if we are able to bring to the consciousness of healthcare workers in all rural areas and also health facility settings, and we give them standard definition of cases that you should look out for, and when those cases are identified, they should report appropriately to the authority. Because when you do that, what you have done is that you alert. It's an alert system. So when you activate that alert, the required authority come to play their role and ensure that whether there is need for you to actually isolate people concerned, or there is need for you to begin to watch out for the progression in that condition, all of those things will be put in place. Then the other thing that we need to understand is that we need to man our, border system properly. For example, in the South America now you have the outbreak of virus that is causing a lot of troubles. And if we don't have system in place to ensure that people that are coming in and out of our country are properly checked for some of these conditions, we just get them imported, or we can even export them to other countries if there are problems with us. So there are quite a number of things that we need to do, but we also need to know that some of these things come at a cost. The government needs to increase facilities and equipment that will enhance diagnosis and disease identification. That way, we'll be able to curb the effect of migration on disease spread.
How does immigration affect health?
Migration has actually been a very serious, migration actually impacts seriously on health. And you know that people move, somebody can be here now in the next couple of minutes is far from here. And unfortunately, there are quite a number of constraints with respect to identifying people whether they are sick or not, as to maybe put in place some check as to who should move and who should not. For example, look at Lassa fever, for instance. Lassa fever has an incubation period of 6 to 21 days. And you can imagine somebody could be infected, still looking apparently healthy, and therefore travel from where he is to another place. Getting to the place, it could come down with the illness and then become a risk to the people around the places. So you find that it's very difficult to confine some of these conditions to places because of the fact that signs and symptoms are not always apparent at the point of infection. But be that as it may, we need to appreciate the fact that the public health methodology has been put in place to ensure that diseases that are capable of being spreading or infecting others are put in check, and one of those is surveillance system. There are what we call reportable disease conditions, meaning that once you identify that condition, you must report to the appropriate authority. If you listen to the Minister of Health recently, he actually alluded to the fact that one of the reasons why Lassa fever has been a problem that is almost difficult to manage is because the people concerned do not report those conditions when they identify them.
Waste management is a communal responsibility that affects not only you, but your neighbors. So let's build the consciousness of waste management among Nigerians. Let's take our tips on how to keep our environment clean.
Health tips on proper waste management. Do not dump refuse in the gutter. Do not empty your trash cans into the flood because the water will not take your refuse to the dump site. Dispose your garbage to the appropriate authority. Ensure your garbage is neatly tied up in a waste bag before disposing it. Do not dump your refuse on the walk path or on the road. When in public places, always ensure to use trash cans. Always ensure to take part in sanitation in your neighborhood. Ensure all sewage and broken pipes are covered. Clean environment is a collective responsibility, and cleanliness is next to godliness.
The environment is paramount in our everyday life. Let's keep it clean to fight diseases by making cleanliness habitual. And that is all we have for you on the program today, and we hope we've been able to educate you well. Join us again same time, same station next week for another interesting topic. Remember, your health is your wealth.